Okay, thank you, Heike. Thank you all for joining us on the call again this week. Today, we really want to take a moment to recognize this special day as the 19-year anniversary of 9/11. On that day, our country lost thousands of innocent lives, and we've all been impacted by it in some way. It may be through knowing someone at the World Trade Center on that particular day, or even knowing a civil servant, a firefighter, police officer, or military personnel who's dedicated their lives to protecting our safety in response. So today we face another challenge of the COVID pandemic. We're all working together to protect each other and our loved ones. In this time of community, we support those diagnosed with COVID and those frontline workers that fight it every day. And yet at the same time, we mourn those who we've lost to COVID. So we want to take a moment of silence as we begin our call to reflect on the community and the partnerships that we build during these difficult times, on our frontline heroes, and for those who work tirelessly for our safety, and finally, for those lives that we've lost. From all of us at the division, we really want to thank you very much for all of the hard work that you do each and every day. And with that, do we have Val in for updates, or are you ready for
Val,
me?
Yeah, Val has a conflict this morning, so if she is able to join us by the end of the call, we'll move her stuff to the end. So if you want to go ahead with your update, Angie, that'd be great.
I will. So we have a few updates. On August 31st, CMS sent us a letter outlining various blanket 1135 waivers for our intermediate care facilities, our ICF IDs, to address some of those continued challenges that they experience by the healthcare facilities that are specifically related to COVID-19 pandemic. And so we are going to be posting that, if it's not already posted, on our website, just so that all of our ICF ID facilities can see some of those blanket waivers. It's very nicely laid out in a summary of what they've provided for us. And additionally, we wanted to let you know that we submitted a disaster state plan amendment for our TCM, and it was approved by CMS on September 1st, and that has been posted to our website. This disaster state plan amendment is to allow the flexibility to provide the case monitoring via the telephone for all 4 quarterly contacts in lieu of the face-to-face contact for one of those quarterly contacts. We originally requested this through the 1135 submission, so if it feels like we're repeating something that we've talked about months ago, we are. But really, we had submitted originally through our 1135 submission, but CMS required us to submit it through a SPA, a state plan amendment, since it is specifically a state plan service. And then also, we wanted to let you know that at the state, we're in the process of submitting a second Appendix K for the waitlist implementation due to the budget impacts from COVID. So we will be sending that in hopefully in the next couple of weeks. And then over the next few weeks, everyone knows that we've been working on our waiver renewals, but we have also been working on 2 waiver amendments, and that's for the waitlist, so helping us to reduce some of those unduplicated participant slots in our waivers because of the waitlist, and also the reduction or the removal of the person-centered strategies, consultation, and counseling services. So MoHealthNet is also working with us to send out a public notice for those waiver amendments. And again, those are all because of the impact of COVID and legislative appropriations. So you will see those posted shortly before you will see the waiver renewals posted for processing to CMS. And that is all that I have for today. So I will turn it over to Wendy.
Okay, hi everybody. I have 2 or 3 things to touch base with you all on. First is we've gotten some questions around the returning to in-person monitoring guidance that went out. And so I will be updating that to provide some clarification. But in advance of that, I just wanted to elaborate on in the IQFM database that the reason that we're putting the type a visit in that IQMF database is so that we have the ability from central office to be able to see if people, providers, and TCM agencies are making that transition to in-person monitoring, and when not possible to do in-person monitoring, to virtual monitoring. So really looking at that report and pulling that report from a central office level is the only way that we have to see if our network is making that transition successfully and where there might be problems and how we might be able to help problem solve getting some of those things done. So it is really for a central office monitoring function. It is not anything that the TCM TACs are reviewing or paying attention to. Their review has not changed at all. So just wanted to kind of elaborate on that as to what the purpose of that and why we have to do that now. We are asking that all support coordinators report every visit in the IQMF database, which is different than before. Before, you only did it if there were negative findings. We're asking you to report all visits in there so that we can track the type of visit that it is. You don't have to report, make additional comments if there were not negative findings, but providers always like it when we have nice things to say about things that we've observed as well. So don't hesitate to put in those positive things in there, but at the very least, you just need to report what type of visit it was so that we can monitor that and help out in areas where providers are still struggling with that. So I wanted to elaborate on that. And just to point out that don't get too caught up in the examples that are given in the guidance document. Those examples are to demonstrate the documentation and how you need to be clear in the documentation about how the responsibilities of the support coordinator are different. For specifically talking about where you're choosing to split responsibilities between two support coordinators. So one support coordinator is maybe going and doing the in-person visit, and another one is doing other components of the monitoring. That example was just to demonstrate how the documentation of the responsibilities needs to show that those were distinctly different activities and not just say I provided support coordination, because then it will be seen as two people doing the same activity and it will be duplication. So I'm not meaning to make any judgment as to how you divide up the responsibilities. I have no expertise in that area. That can be done a million different ways, and it's all going to depend on how you have your organization and your caseload set up and individual factors you got going on there. So those examples are not to provide any guidance as to how you should divide up responsibilities, only on the documentation. We also had some questions coming in for clarification around who is responsible for providing the technology in order to do a virtual visit or a remote visit. So both a service provider and a TCM agency have responsibilities around monitoring. So both of those providers need to have the technology needed on their respective ends to be able to do that monitoring. However, in many cases, a support coordinator may do monitoring in the individual's home. So if you're doing monitoring at the person's home, it is not the service provider's responsibility to provide the technology for the family member. I encourage the team to get together to problem solve, to come up with ideas of how you might get past that. But in the end, the bottom line is it is the TCM agency's responsibility for monitoring. So if all else fails, you know, the buck does stop with the TCM agency. I know that some county boards have provided tablets for their support coordinators to allow the family to use while they're there so that they can do, you know, talk better or do a remote visit if other options aren't available. So there's a lot of solutions out there. There's no one right or wrong way to do it, and I think probably the team can come up with the best ideas of how to do that. But so hopefully that clears up some of the questions around who is responsible for the technology. I think a lot of that comes down to, you know, not all face-to-face visits have to be at the site of service. And so when they're not, then who is responsible there? And so I think we've kind of covered that. The other thing that I want to point out about the virtual visits is, yes, if your county is on a remote-only status, all that means is that basically the division is giving the green light for you to do virtual visits in those situations. However, it does not preclude you from going to the home and doing a face-to-face visit. It is perfectly safe to do that, taking all your precautions, using PPE, social distancing, and doing all of those things. We're doing the remote only and the county status system to help support the local health agencies to reduce the footprint in those counties during those times as they're trying to lower the prevalence level of the virus in their counties. So it is not a blanket rule that you cannot do in-person monitoring. So in cases where you can't come to a resolution about how to make technology available to the family in their home, the one solution that's always there is you go out to the home and you do face-to-face monitoring. So just kind of wrapping that up about the virtual visits and what we need to do there. Then we had another question that came in, and it's more around choice, and specifically about choice, but about how we are going about assessing when people can get back out into the community. And this is tricky, and it's kind of a difficult question to answer. This one specifically is around voting. Someone who is living in an ISL and is a registered voter wants to vote on November. They're being encouraged to do a mail-in ballot, but the individual does not want to do a mail-in ballot. They are not trusting the mailing system, and they want to go vote in person. And so the question is, can the provider disallow that? And no, the provider needs to work to find ways to make that right available to that person to be able to manage that and to be able to go and vote. We should be doing individual planning with all of our individuals let me repeat that again, individual basis. I mean, it just can't keep being redundant there. But what does it take for this person to be safe in the community, to be able to re-engage in the life that they had pre-COVID? What precautions need to happen for this person? And then, yes, there do need to be considerations taken for other people that live in the home, but it all needs to be done on a team planning level. We're getting some information that there are still program-wide rules about everybody is not to go out into the community, and we shouldn't be having program-wide rules. They should be individual-specific, house-specific, and even if you've got people living in the home that have risk factors, are there things that can be done to mitigate those risk factors? We need to be doing individual planning and helping each person to learn how to be safe in the community and returning to their normal lives. We're not going to be able to protect everybody forever by not going out and getting re-engaged. And I know we've had the conversation in the general population, but we need to really pay attention to it in our population as well, because our folks are probably even more isolated, and we need to be sure that we're mindful of the emotional health risks that poses, and are we tuned into those, and are we working to mitigate any of those risks and try to put some procedures in place. So I just can't emphasize enough that while we're all being very mindful and trying to keep people safe in their homes, we also have to be respectful of their individual rights and choices and how they want to get back out and get involved. And so we need to be working towards accomplishing that. There's a couple questions in here that are specific to Maccabi and LOC level of care assessments, and I'm going to not speak to those. I don't have the specific information on that, and we will put that and respond to that in the Q&A and put that out by probably early next week. And looking to see here if I have other questions. Before we get into questions that are coming in on the chat, Val has walked in and joined us, so we're going to let her do her update. And
what have you guys done? Have you done anything?
We've not talked about any of your stuff. So we'll let you do your update, and then we can get to some questions.
All right. So quickly, I usually talk a little bit about a lot of different things. So we don't really have any budget update at this point. While revenue, we still are very unclear about where we're going to end up with state revenues, and we're also very unclear as to how the federal government, if or how the federal government will be helping states manage through this COVID recession. With that said, yesterday I saw in the news that the federal government did not move a bill, and now it doesn't look likely that any federal relief will be known until November, which probably means after the election. So that's just more uncertainty in terms of the federal relief we have going, how it can be used, as well as uncertainty as to how long it will last, is really what that equates to for us at this point. And with uncertainty becomes an inability to really finalize some decisions. So please know that. Also, we usually talk a little bit about testing, so COVID testing. And I can't tell you, and I know a lot of you guys have seen this stuff in the press, but Missouri, I think right now, is got the 7th highest rate per 100,000. So we're around 150 per 100,000. According to the White House Coronavirus Task Force, that puts us in red in terms of prevalence of cases in the state, in the country, and then 7th in terms of the states with high prevalence of cases. Almost all of those cases are in the Midwest. All of those the ones above us are in the Midwest, including several of our neighboring states. So that just makes it even harder, and we've got examples of both in our state-operated facilities and with our private providers. I know you guys are doing everything right. You are testing, you are screening employees, you are utilizing PPE, and we're getting 10 positive residents a day right now in the waivers, or 10 positive waiver participants a day right now. So it's just, even when you do everything right, you can't keep this out. And I know we talked about that a lot in April and in May, but we weren't seeing the numbers on the community side. We are now. So just continue to be vigilant on your testing, continue to be vigilant on your monitoring of staff. Please understand what your staff are doing, where they're going, and wear a mask, wash your hands, all those things we tell you to do over and over and over and over again. Testing is going to get a little easier in the state again. So statewide testing without doctor's notes, that drive-up testing that we had been doing in June and July will resume next week in the state. We've posted that out there for everybody, and then there will be more of those that come out every week. So please pay attention to those when we post those to you, and we send them to you through a variety of channels. That's one of those pieces of information that every time you get it, you should be like, yep, that's good. I want to get that as many times as I can get it, because I want to make sure I know what's going on. If you're not getting it enough, talk to your regional office. They will help you make sure you're getting it as many times as you can possibly get it. So we are really trying to up the testing in the state again. Really, overall, if you look at the White House results, our state's testing numbers are not bad, but because of the high number of positives we have, we really need to increase those testing numbers. Also, areas in the state that seem to be hotter than others, one of the facts that we got this week out of the Fusion Cell was while less than 60% of our 40% of our population live in rural Missouri. She's got it. While 40% of our population live in rural Missouri, 60% of our cases right now are in rural Missouri areas. So please, please, please pay attention. No area is immune right now. I know you're also occasionally hearing in the press that your county or your city is called a red city or a yellow city or a green city. next time we'll probably try to show this to you a little bit more clearly. So the White House has put out what percentages you have to be at to be a red city, to be a yellow city, to be a green city or state, and they go to a very, very detailed level. So sorry I couldn't join earlier, but next time we do this call, we'll go through and show you what that means and what that looks like. And there will be public ways for you guys to see what that means for your areas. But the reason you become red is, again, your cases per 100,000 over the last 7 and 14 days, the amount of testing that you guys are doing that is occurring in your community. That includes the testing that we do of our staff and our residents. All of that testing helps. And also, deaths are included in that, and there's something else that I can't remember off the top of my head right now, but those are the key factors. And so we will continue to educate you on what those are and what those levels mean. Right now, I know, like in the paper this morning, I saw that Cole County and Jefferson City both were considered red. So both the Jefferson City and Cole County are considered to be a red county. Yes.
Local public health agencies, get connected to the social media platforms.
Yes.
Because that's how you're going to know what's happening in your community in regards to spread.
Absolutely, and we will continue to work with you to make sure that you have access to that information as locally as you can get it, and we are working on getting that out to you. And I know you guys are using all the tools we're giving you right now too, but I know there's new ways that we're talking about it in terms of red and green. Oh, here they are. Sorry, the trajectories are right. Oh, these are small. It's also positivity rate of testing. So that's the one I couldn't remember. So how many tests you've done, what is your positivity rate? And we've talked a lot about positivity rates. As a state, we want that positivity rate below 10%, ideally below 5%, and exceptionally would be below 3%. And as a state right now, our positivity rate is above 10% for both the last 7 and 14 days. So those are the things that we look at regularly to see where we are, how we are responding. I will tell you that lab turnaround times right now are really well. So if you had been using a lab and you were a little bit concerned about continuing to use a lab, they have improved quite a bit. Also, we know there's new testing technology out there, and how can we better utilize these new testing technologies so that we can test more frequently, make the testing easier, all of those kind of things. So I kind of like a product launch, you know. We know that there's this new product out there, but you got to stay tuned because it's really not available for everybody yet. And so that's what we're here to do, and we will keep you educated as to what those different testing technologies are and when they're actually fully available and operational for our folks. But I know you've probably heard a lot about the Washington University saliva test, and we will continue to work with labs to get them identified so that we can make use of that test. That is a PCR test versus an antigen test or an antibody test. So that means it's going to get the closest to identifying true positives and true negatives. The antigen test typically can identify true positives, but they can't identify those folks that are asymptomatic as well. And so that's kind of why those are the things we're trying to learn more about. Yep. Okay, the other thing I wanted to talk about real quick, CARES Act funding. So I know that we have several providers that are still working on getting their CARES Act funding information into us. We have not quite put out $2 million worth of our $20 million of CARES Act funding. We want to get that money out the door. I want my staff working all night long and trying to push that money out the door. We're not doing that right now. So please continue to work on getting those invoices into us and those attestations if you're a group home or a residential provider. Vaccinations is another question that we get a lot whenever we're talking to folks. So I will tell you what I know. The state has been notified that we will start getting COVID vaccinations sometime in the fourth quarter of 2020. The fourth quarter of 2020 starts on October 1st. It ends on December 31st of 2020. So somewhere in those months, the state of Missouri will be getting vaccinations. We also know that we will not be getting enough vaccinations for everybody. So we are working on prioritizing populations. We also know that the federal government will establish certain priority populations for us, just like they do for testing and other things. So those are things we have to keep in mind as we work on, we are working on vaccine distribution plans. Other things you need to know about the vaccine: it has to be kept cold, negative 70 degrees Celsius. They're still trying to figure out how long it can be refrigerated where it's still viable. Is it 24 or 48 hours? So those are things they're still looking at. So That also makes it difficult when you're determining how to get the vaccine distributed and utilized within a short period of time once it comes out of that negative 70 degrees Celsius environment that it has to be kept in. The vaccine, and we've talked about this several times, is a 2-dose vaccine. So you will get one on one day, and between 21 and 28 days later, you will get your second dose of the vaccine. The vaccine you have to get from the same provider. So if you get a vaccine from the pharmaceutical company Pfizer the first time, you have to get a Pfizer vaccine the second time. You cannot get, so it's not like, oh, on day 1, I'm going to go to Walgreens to get my vaccine, and on day 28, I'm going to go to my doctor to get my vaccine. It's not that simple. You have to pay attention to all of these details. It's also not going to be available that way, so don't worry about that. But those are some common questions we get on the vaccines. Again, please pay attention about the testing. The division is still supporting testing of our residential congregate providers. If you want to get testing,
Use the website.
Use the website. There's a link.
Yep.
Send it to us. We will work on connecting you to testing partners. We've had a lot of really good luck with that, and we will continue to work on that. And as our testing partners get access to new testing technology, it will become easier for them too. Also, take advantage of those community testing events as well. I know I actually just got off the phone with a partner agency talking about kids going back to school. It's happening. And also talking about what do you do with your staff when you have a kid that gets sent home as a contact, not as a positive, but as a contact and told to quarantine for 14 days. And I'm not talking about the, what is your parenting responsibility in terms of taking care of your child. But there's some challenges with that, and there's some things that we're going to have to work through over the course of the next few months. But for us, that until there is a positive member in the house, until there is an actual positive member in the household, we will treat that the same way. So that employee can still come to work, and as they will be wearing PPE. If you've got testing established in your agency, one of the things that we will likely do is increase the frequency of that employee's testing while that child is home on quarantine. If at any point that child is positive, we typically send household members home when they have a household member who is positive, and we put them on quarantine. But otherwise, we don't treat it any differently because we test and we wear PPE and we screen our employees on a regular basis. Here's a question on DMH CARES funding. They submitted a portion of it invoiced now and a portion later before. Yes, absolutely. Now, we will not pay invoices that are below $500, so until you get to $500, we're not going to go through the process of cutting you a check. But yes, please submit part of it now and part of it then if you can't get to the full amount you're owed to right now. Absolutely. And if you have more expenses than what you are putting on those invoices, submit that to more than your allocation is. Please submit the full cost of your full needs, because if there is an opportunity for us to get that reimbursed, we will take that opportunity as well. So, Kim, just let me know we have 383 callers on today, so thank you all very much. And now, do we turn it over to Kim, or is everybody else done?
Kim. Okay. And so just real quick, thanks, Val. Just a quick reminder, we had a couple of questions come into the chat box on where testing is available through the community testing efforts. Again, I know we posted this week, and we'll continue to do that. And as soon as we get the information through DHSS and other state colleagues, we post. So please go out and look at that. There's a lot of community testing efforts going to be continuing to happen. So another good opportunity, again, to get access to testing. Quick reminder again, this was a question in the chat box as well. The point in time where the agency-wide testing that we've been supporting everyone to get done through those connections with the FQHCs, our community health centers, that's ongoing. So if you initially thought no, that you didn't need it as an agency or you weren't interested, and now you decided that you'd like to do that effort, please submit your request with the information. Also for ongoing testing, if you've done the agency-wide testing, but you would like to do ongoing, or what we refer to as sentinel and surveillance testing, a percentage of your staff ongoing, again, please reach out, let us know, contact us through that email site, and we will support you to get that happening. Ongoing efforts there. Just a real quick reminder, again, I know sometimes we repeat things, but I think it's important for messaging. If you have not connected with your local public health agencies, please do so. They're wonderful resources. They have those social media sites, and that's really how you're going to be able to monitor and know what's happening in your communities. As well, there's information that DHSS has through their dashboards, which is updated daily through the Department of Health and Senior Services. that can also assist and support you when you're having to make those important decisions, whether it's at the individual planning level or it's an agency trying to make important decisions. Also, just looking at my notes here, questions around PPE and access continue to come in. There's continued resources available. Again, the Google Marketplace is a great resource. DHSS has on their webpage designated areas where you can access and request. The SNS ordering form is also posted on our website. I know that we recently received some information and we'll be posting that out today. Hopefully it'll go out this afternoon, if not first thing Monday, through the statewide information on agencies and companies that are developing PPE and producing PPE in the state. So we have some resources for you available there as well. So stay tuned on that information. Real quick too, ongoing conversation, we like to provide you with updates on the utilization of StationMD. Just as a reminder, we do have a designated webpage for that information if you're not familiar with StationMD and what the service is. Currently, all individuals who are recipients of waiver services are auto-enrolled to be able to access StationMD services. It's very easy to access and utilize. So if you have a need, please feel free to access it. We did have an example case where a family wanted us to share with them some of their positive interaction with utilizing the service. This particular family supports a loved one who has pretty significant medical needs and is not able to verbally communicate very well and had a decline in their health. The parent was really concerned and was wanting to try to figure out what the next steps were to kind of access care, and remembered StationMD. Contacted the number, they walked her through how to access the information, quickly received a response from StationMD. They were able to assess through telemedicine the individual's needs and direct them to go ahead and present to the ER, which they did. The care there was very well coordinated from the feedback because StationMD had contacted the ER ahead of time, and the parent just felt that the whole process was very positive and wanted to share that and encourage everyone to take a look at the service. So we appreciated their feedback, and we wanted to pass that along and share it with you. And again, if you have any questions about the service, please reach out to your regional office, and we've got a lot of information out there.
I think she and a lot of parents think that it's going to be complicated. You got to download the app, you got to fill out all this information, and it really isn't. It was very quick, very simple, and so she didn't want people to put off using that for fear that it was just going to be a hassle.
Right. And one other quick reminder, too, we have a lot of resources out there. We continue to have those trainings in the Reliance platform that everybody can access through the MoDD portal. They're on a variety of topics that can support you if you're an agency on your policies and procedure development, on your staff training around infection control and prevention, around the utilization of PPE. So again, those are really great resources that we have available to you to support you in your local efforts. And just greatly appreciate all the work that everybody continues to do.
So I want to jump in on what Kim said about those resources. So those of you that are multitasking and listening and doing something else, this is that moment where I want to beg and say, please pay attention to your monitor. I promise it will save you heartburn later. If you will take a look at your screen now, this is our DD homepage. You scroll down and click on Community Supports. You're going to see a section there that says Education and Learning. When you click on that, there is a dedicated accordion here for the Reliance self-registration portals. Those modules and things that she mentioned are located in the MODD content self-registration portal, which is different than our employment support self-registration portal. A lot of times we see folks having a little trouble and they're going into the wrong portal. If you have questions on that, feel free to submit that to me. Send me an email, drop me a message in the chat box. But just know this page right here can be your best friend if you're struggling to find those modules or needing a little help, or your staff, they need to print certificates or something like that. So just a quick note.
Thanks, Micah. And not to put you on the spot, but while you've got the web page pulled up and we've got everybody's attention, could you quickly pull up and show them where those email blasts are when we're communicating out on the community testing?
Love to. So if, again, you go back to our homepage and you'll see the scrolling panel here. Take a moment, get some good information. If you're not signed up to receive those email blasts, you can do that by clicking on this page. It'll take you to an external site. But if you know something came out, or hey, I'm not sure if something came out, click there, and we have all of these email blasts that have been sent out in archive. You'll be able to go back, obviously, to 2017. But that can be your best friend if you're looking for something quickly and you know you've seen it, but you don't exactly remember what it was or where to find it. You can easily go right here to get to that information.
Right, and so we just sent out this week the first on a series that we'll be expecting on those community testing events. And so for next week, I know there's sites set up, and it's as easy as going and registering online and showing up and getting tested. And I know Boone County in Columbia has some sites set up. There's some sites set up in St. Charles, I believe down in southern Missouri.
Yeah, Perry
County.
And they're going to keep changing.
They'll
so they're
change
every week.
Yeah.
So pay attention.
Yeah, so please be looking for those.
We've got actually a couple of questions here, and there are things that have been addressed. And first of all, I get right now that there is a lot of community anxiety about finally knowing people that are COVID positive, when before you probably didn't know anybody who was COVID positive. Now I don't think you could throw a rock and not know somebody who, you won't be able, I don't think you could throw a rock in this room and wouldn't be able to find somebody who doesn't know somebody who's COVID positive right now in the state of Missouri, is what I'm saying. So knowing that, I see some questions in the chat, and first of all, the CDC website is your friend.
Yep.
It can help answer a ton of these questions. Two of the questions that we just specifically got, one was a question about if you're positive, how long are you contagious? Well, a couple of things will matter here. One is how severity was your illness. If you were asymptomatic the whole time, you never had any symptoms, you never had any fever, 10 days from your positive test date, you are no longer considered contagious at this point. You can re-enter. You should, if you've been COVID positive and you're 10 days later, don't go out in the community without a face mask on. Put that face mask on, wash your hands. You should still be limiting your exposure, but you are no longer considered contagious at that point if you are completely asymptomatic. If you have mild or moderate symptoms and those symptoms are gone for more than 48, you've got 10 days at least, but if you go a little bit longer, you need to be 48 hours fever-free. That means no fever with medications. Then you are 10 days and then 48 hours. Sometimes that all comes at the same time. Then you are considered symptom-free and you are no longer contagious. Again, do not go out in the community without your mask on. Do not think that because you've had COVID and you are now recovered, it is a free pass to do whatever you need to do. We still require anybody who has recovered from PPE to wear full recovered from COVID. Yeah, we all are going to recover from PPE, right? Recovered from COVID. They still have to wear their masks at the facilities, and they also still, the 2 weeks that they come back to work, they are wearing full PPE at that point. So just want to make sure that everybody understands that. Now, if you have more advanced illness, those dates change, but the CDC includes all of that information on their website. It is very easy to read, very easy to access. Another question we got was if you were around somebody on Friday and then on Monday you found out that they were COVID positive, are you at risk? Okay, first, right now, everybody is at risk. We are in a community transmission in the state of Missouri. You can go to Walmart, you can wear your mask, you can wash your hands, you cannot be around anybody else, you can get COVID. So I don't want anybody to think they're not at risk at all times, because right now you are at risk. Second, though, I want to make sure that you yes, we would consider you a positive contact, and if you worked in one of our facilities, we would test you within 5 days of that exposure. And if you've been around in the facilities, if you've been around somebody within 7 days, we consider you a positive contact. So that is how we do it in the DD facilities and all of the DMH facilities. So if you were around somebody on Sunday and then on Saturday we found out they were positive, the next Saturday we would consider you a positive contact. We go back 7 days.
Again, your local public health agency should be supporting you on those contact tracing efforts, but you as an agency still need to be thinking about your own individualized policies and how you're going to be addressing some of those contact tracing efforts and how you're going to be addressing with your staff.
And as an individual and somebody who is just thinking, oh my gosh, I just found out that my office mate has COVID, what do I do? Again, please, we have information on our website. The Department of Health and Senior Services has information on their website. The CDC has information on their website. All of these kind of questions are very easy to find answers to on the website, and those policies are the policies that we are following as a state. So there was another question about the vaccination. They just wanted me to readdress the vaccination. And yeah, I have a mask on and I'm farther away from the phone, so I'm trying, no, it's fine because I'm reading. So I'm sorry if the audio is breaking up, but we're in a room together and we are wearing masks. So that's why that's happening. There was a question about, again, what is the expectation for vaccine availability? So the state has been told that we will get vaccine, COVID vaccine, somewhere in the fourth quarter of 2020. So that's October 1st to December 31st of 2020. How much we're going to get, we don't know. Who's the intended audience for what we get, we don't know. But we know that something should arrive during that period of time. It will likely be focused on large congregate settings and the workforce in those large congregate settings, because those continue to be where we see the worst outcomes. And then there was finally, somebody had a shout out, and I'm not sure everybody can see it, but apparently the Department of Health in Kansas City has face masks to donate. Cases of 2,000 are available, as well as masks for kids. So way to go, Kansas City Health Department, for helping make sure everybody has access to masks. And is there an updated information about the expedited UR process? We will work on that in the Q&A follow-up, okay? We've been on this call plenty long. Thank you all for sorry.
We got a bunch of questions still. But
they're
all around monitoring.
You know what? We're going to go ahead and address all of those monitoring questions in the Q&A. So let's just do that. And because we've been on here for now 45 minutes, and I think that's enough time, and we are starting to not really drop people, but I would if I was. I would be losing interest. So thank you all for your time today. Pay attention to the Q&A. There's a lot of monitoring questions out there, and we'll get those out. We always get them out in writing to you anyway, but we will go ahead and do that this time too. Thank you, and have a good weekend. Stay safe, please. Bye.